Hi, everyone. Great to be with you. Let me start by first congratulating Dean Rani and really the entire school on achieving independence, a really momentous occasion. I want to highlight briefly 5 key moments from my time as dean. First, when I joined, it was a turbulent time. There had been discussions even about closing the school, but thanks to strong advocacy by the faculty and by alumni, the school stayed open. Nancy Ruddle did a wonderful job as the interim dean, and until the permanent dean was appointed. With her guidance and support from the medical school dean at the time, the late Jerry Burrow, I was given for the first time the title of Dean of Public Health. This allowed me to represent our school directly with university leadership, and that was very important at the time. Secondly, under Dean Burrow's leadership, we received a great deal of resources to grow the school, which we really needed. Over my decade as dean, we doubled the size of the faculty. We doubled the size of the amount of grant income. Our student enrollment went up 30%, and we did some very important renovations of our research and teaching space. And many of the faculty members that I were fortunate to recruit have just had stellar careers. Third moment I want to mention was the fact that at that time I was dean, AIDS was really reaching a peak in the U.S. and in the world, and gaining a lot of attention for public health. And this resulted in a lot of more interest in Yale undergrads, and this in public health, and this allowed us to set up for one of the first programs in the country, what we call a BA or BS MPH, or a 4+1 program with Yale College. Fourth, again, now moment sticking with AIDS. We were fortunate, about 10 faculty at the school, we worked together and were awarded an NIH Center grant for the Center of Interdisciplinary Research on AIDS. It's the first big AIDS center funded by NIMH that focused on international AIDS. And this allowed us to really have leadership in this area. And that center is still alive and doing very well 25 years later. And then the last moment I want to mention has to do with our independence. With Sam Chauncey's guidance, I worked hard and advocated for the school to be independent. At the end of my tenure, the university conducted a review of the school, and that gave us one last chance, but it didn't happen. The university president spoke to the faculty, explained that I had made repeated petitions for independence, but really this was only going to happen if the school could be ranked as a top 5 school, and that it had the sufficient resources to be a top 5 school, and that he thought it would take at least a decade. Well, it took 2 decades, but we're here. You've achieved independence, and I don't believe it's going to take anywhere near that long for the school to be ranked as a top 5 school and continue to provide leadership and have impact in public health in New Haven, in the country, and in many countries of the world.